उसके बाद क्या करे, हाँ उसके बाद क्या करे लोग, इंसुलिन पे लगाए आपको, करेक्ट, 1 साल पहले।
इंसुलिन अब जो
जी
है अब आप लोगों के पास से आने की वजह से इंसुलिन सब बंद हो गया मेरा।
जी जी
Welcome to eMedicard Global, where we celebrate remissions and reversals. Today, we have with us Mr. Syed Yaqoob, aged 68, who had been suffering from type 2 diabetes for more than 25 years. He was taking Metformin and Glycomet for 25 years, and for the past 1 year, his endocrinologist had also started him on insulin, 12 to 15 units. He later underwent dialysis for chronic kidney disease and also suffered a heart attack on 13th February of this year. After joining our program, he is now off diabetic medications and has not required any dialysis. To discuss this further, we have the founder of eMedicard Global, Dr. Khan, with us. I request him to take this interview further.
Thank you, Dr. Srishti. Thank you so much for the introduction of one of the patients. We have with us Mr. Syed Yaqoob. Okay, he has joined us from India almost since 3 to 4 months, and he was basically suffering with diabetes and linked and comorbidities linked to diabetes, like chronic kidney disease. He was even put on dialysis. He had to go for dialysis twice before he came to our program. He was also put on insulin by his endocrinologist, and he also suffered a heart attack at the same time. So we'll discuss with Mr. Yaqoob how he's feeling after coming to the program, what we have done to his medications, and how he's feeling overall after joining our program. So let's ask Mr. Yaqoob. Yaqoob brother, assalamu alaikum, welcome to the show. क्या आवाज आ रही है आपको हमारी? Can you kindly unmute please? जी अस्सलाम वालेकुम, कैसे हैं आप? कैसे माशा?
पैरों का बहुत है, पैरों का कुछ करो ना सर।
जी वो भी हम डिस्कस करेंगे पाँव का भी। पहले आप ये बताइए याकूब भाई, अभी आपकी तबीयत कैसी, हाउ आर यू फीलिंग?
तबीयत अल्हम्दुलिल्लाह सब सही है जैसा तबीयत
जी,
मेरे जा रहा अल्हम्दुलिल्लाह। ये हफ्ते में खाने का भी बहुत अच्छा भेजे आपको।
जी जी
कभी बहुत अच्छा लगे।
देखिए अभी आप जी बताइए
जैसा पाया है, पाए में मैं गेहूं की रोटी को चूर के खा सकता हूँ।
बिल्कुल बिल्कुल, हम आपको बताएंगे सब क्या खाना है, वो उसका डिस्कस करेंगे। इसके बाद आपका डिस्कस करेंगे एवरीथिंग पूरा डिटेल। पहले आपसे ये डिस्कस करेंगे, आपको अभी पहले जब आप आए थे हमारे प्रोग्राम में, कितने महीने से आप हमारे प्रोग्राम में? 3 महीने से, करेक्ट?
करीब 3 महीने
3 महीने होने आ रहे, करेक्ट?
3 महीने।
तो अब 3 महीने में कैसा आपको फील हुआ? तो 3 महीने पहले कैसा थे आप, अब कैसा फील हो रहे, कैसा?
नॉर्मल हो गए, शुगर तो नॉर्मल हो गए, खाना हजम हो जा रहा है। शुगर से बहुत था, शुगर नॉर्मल हो गई। और
शुगर नॉर्मल हो गई
मेरे
जी
को ये से लेके नीचे तक पैसा बस वो अगर मेरे को सही हो टूटना
जी
बढ़ना
हाँ, वो भी हाँ जी हाँ वो भी डिस्कस करेंगे हम लोग। मेरे को ये बताइए, आपको अभी पहले इंसुलिन लेते थे आप, इंजेक्शन, राइट? सो जी, तो आपको पहले इंसुलिन अभी लेते थे, कब से आप इंसुलिन लेना शुरू करे थे? कितने साल पहले शुरू करे इंसुलिन लेना?
तो ये बीमार पड़ा जब से लिया मैंने, तो नहीं लेता था इंसुलिन, गोली खाता था।
पहले गोली खाते थे। गोली कितने साल खाए याकूब साहब?
15-20 साल खाया मैं।
15-20 साल गोली?
ग्लाइनर बोल के आती थी गोली।
जी जी
खाने से पहले एक खाता था, खाने के बाद मेटासिन खाता था।
अच्छा,
ये सुबह दोपहर शाम एक
जी
कम पावर के थे गोलियां,
कम पावर के थे,
एक गोली खाओ
जी
एक खाता था सुबह दोपहर शाम।
ओके, फिर उसके बाद आप गोली खाए, गोली जब खा रहे थे इतना, राइट? फिर उसके बाद भी फिर आपकी शुगर कंट्रोल में नहीं थी, राइट? तो उसके बाद क्या करे, हाँ उसके बाद क्या करे लोग, इंसुलिन पे लगाए आपको, करेक्ट, 1 साल पहले।
इंसुलिन अब जो है अब आप लोगों के पास से आने की वजह से इंसुलिन सब बंद हो गया मेरा।
जी जी जी
ठीक, सुबह पेट में दर्द इंसुलिन ले रहे हैं, शाम में पेट में इंसुलिन ले रहे हैं, मेरे परेशान हो जा रहा था। अब अल्हम्दुलिल्लाह कोई वो नहीं है। अब सुबह भी चेक कर रहे हैं, खाने के बाद चेक नहीं करा मैं, खाने पहले सुबह चेक कर रहा हूँ, 90 80 90 80 90 चल रहा है।
जी नॉर्मल हो गया अभी?
हाँ
अभी नॉर्मल हो गया आपका?
नॉर्मल हो गया अल्हम्दुलिल्लाह। ये
हम हमारे गोली तो कुछ खाए नहीं, बगैर गोली से नॉर्मल हो गया आपका, करेक्ट?
आपको पता है आपके
जी
ग़िज़ाओं से आपके ग़िज़ाओं से नॉर्मल हो चुका मैं।
जी, ग़िज़ा ऐसे, तो ग़िज़ा मतलब खाना, करेक्ट? तो आपको ग़िज़ा जब आप दे रहे थे, तो ग़िज़ा कैसा दिखा? टेस्ट में कैसा है ग़िज़ा? मतलब ईज़ी अडॉप्ट कर सकते हैं आप ग़िज़ा?
जी,
ईज़ी है ना? ग़िज़ा खाना अच्छा है, नहीं तो गोली खाना अच्छा है? अभी आपको क्या समझ में आया प्रोग्राम के बाद?
अच्छा, ग़िज़ा खा लेना अच्छा है।
ग़िज़ा खाना अच्छा है, करेक्ट? गोली खाने से मतलब ही नहीं है। गोली खा रहे हैं आप, उसके बाद बीमार पड़ रहे, राइट? गोली खाए इतने साल आप 15-20 साल, 25 साल गोली खाए, उसके बाद भी फिर आपका किडनी प्रॉब्लम हो गया, करेक्ट? ब्रदर हसी ब्रदर, थैंक यू फॉर जॉइनिंग अस। व्हाट फर्स्ट टेल मी व्हाट इज़ योर रिलेशन विथ याकूब भाई?
जी,
He's my father.
He's a father. MashaAllah. Okay, fine.
Yes.
So tell me a little bit about the condition. What you want to say about his dialysis condition? Can you just a little bit when he was put on dialysis? How many times he was
Uh,
asked to do dialysis?
After he was admitted in hospital in Feb 14th,
Ji.
first dialysis was done on around 20 or 21st February.
Okay.
Then on 23rd or 24th, he has been done for the second dialysis.
Okay. Okay.
Later on, his urine output was fine, so we have stopped the dialysis.
Okay. Fine. So see, he was put on so many days for so many years because we want to just quickly recap this. For 25 years, he took medications, right?
Yes.
All this oral hypoglycemic drugs, right? So after that, he developed kidney disease and heart issues and all that, right? Then after that,
Yes.
recently, since how many months? For how many months he was put on insulin?
For 8 to 9 months, he was on insulin.
Insulin. So now, when he came to our program, he was insulin, right? When he came to our program.
Yes.
So, and how we have helped him to reverse his condition. Can you just a little bit of talk to the people what kind of foods we have given and how we helped and what was our kind of a support what we gave? Can you just a little bit of um, information to the people?
After joining your program, we have seen much more improvement. Firstly, all the tablets has been stopped, and without the medication, he has been improved a lot. Only currently he has lower back pain and leg pains only.
Yeah.
Apart from them, their BP is stable, sugar is stable, saturation is stable. We were
Yes.
facing all the difficulties in this.
Yeah.
His BP was not stable, his sugar was not stable.
Yeah.
He was completely on oxygen or CPAP.
Mhm.
But now, Alhamdulillah, completely all the things are fine right now.
Okay. Alhamdulillah. So this is all happened after he joined our program, isn't it, brother?
Yes.
Okay. So now tell me a little bit about his heart issue which he developed, you said. So when was the insulin was when they started insulin? Actually, you said 1 year back, right?
Yes, yes.
Okay. So when he developed these kidney issues and heart issues, how many months back? If
In February, suddenly his health was, he started vomiting. So we thought it's a food poison. Then later on, we have went to a local doctor, the family doctor. He suggested that it was food poisoning. But later on, his BP was not stable. So then, on 13th Feb, around 11 or 12 in night, we have taken him to AVC hospital. On the way, he vomited and lay down on lay down. Then after going to hospital, the doctor told us that he got an attack, and they have shifted him to CCU, critical care unit. He was on CPAP, and his BP was not stable, so he was constant on IV NORAD for almost 1.5 months.
Okay.
In
Okay.
hospital, he was on NORAD. Later on, when we discharged him, he was on NORAD as well in home. So in hospital, later on, they have told us that he got a sepsis, and after 4 to 5 days, they told us his creatinine level is going up, so we need to do a dialysis. So we agreed. First dialysis was done on around 20 or 21st. Exactly, I don't remember the date.
No problem.
Then again, the second dialysis was done on 23rd or 24th.
Yeah.
But
And when did you join us?
The condition was the condition was the same. So we have discharged him on 27th of Feb and continue all the medication at home. We have all the setup done at the home.
Okay.
In March, we have joined your session.
Yeah.
From there, in a month, we have seen the changes. Alhamdulillah. From I think from 9th March, he has started talking to us. He has started moving by himself. Before that, he was not talking to us.
Correct. Yes, he was completely bedded. When he came to us, I remember he was not at all talking. We didn't speak to him at all. Not today. He's only talking. I mean, they're not giving us opportunity to talk, isn't it? Today.
Yes.
So alhamdulillah, such an improvement is there. Because this is what people should know. Why we are creating these videos, especially people should know that he's a typical example of what happens when somebody is put on insulin injections. Because the problem in type 2 diabetes is hyperinsulinemia, means insulin is released in abundance, right? And because of that, the peripheral tissues and cells, they become insulin resistant, right? So now, if you're giving insulin more as a synthetic form, what is going to happen? You're worsening the situation. People who are put on insulin, within 1 year, we have seen, either they're getting heart attack or stroke. Mr. Yaqoob is a typical example. Within just putting 1 year, his kidney got deteriorated faster. He had to put on dialysis. Then he developed heart issue, and he has gone through a heart attack, isn't it? He got one small event of heart attack as well. So because what is happening is insulin is life-saving. Remember that, no doubt. To what it does, it maintains the proper range, like a normal range. The blood sugars have to be in normal range in the blood, so it maintains that normal range. But what happens if repeatedly, if insulin is getting triggered by too much of carbs, simple carbs, what is happening? So within 10 to 15 years, the insulin gets exhausted by releasing too much of insulin. That's what's happening. What we do at the platform, we regenerate, because God has given our body such a remarkable regeneration capacity. What we do is we put that into this holistic mode. We put that into food as medicine mode and body as medicine mode. So when we put that, you don't require no medications at all. And remember that insulin should never be given to type 2 diabetes. That is the biggest challenge which I think the whole industry is facing today, because type 2 diabetes should be contraindicated in type 2 diabetes, but they are putting patients with type 2 diabetes also on insulin. And why they're doing that? Because they're totally focused on the blood sugar values, because all doctors currently, what they're focusing on the blood sugar values. But the problem is the blood sugars is a symptom. Remember that. The issue is insulin resistance, which is happening. That's a root cause. And that root cause, we focus on the root cause by reversing insulin resistance. But if you go to endocrinologists or go to any doctor specialist, what they do, or any diabetologist, what they do, they put you on insulin. First, they put on one medicine, two medicine, then at the end they put insulin. And after putting insulin, this is our experience on a platform. We have seen within 1 to 2 years, people who are put on insulin, they either get strokes or they get heart attacks. So Mr. Yaqoob is a typical example here. So don't get stuck with medication. You have great examples which we keep on doing it for you people to understand that insulin, that diabetes, type 2 diabetes, hypertension, cholesterol, fatty livers, PCOS, and all things falls. They are symptoms of one reason, that is insulin resistance. Type 2 diabetes, hypertension, cholesterol, PCOS, and fatty livers, and few cancers, they all fall into one root cause, that is insulin resistance. So insulin resistance means there's too much of insulin got released and they have developed resistance. The body has developed resistance to it. That means they are not able to use the extra glucose which is coming and utilize the energy, because there's too much of glucose already there. That glucose is converting into fats and all that by the insulin. So what is happening currently in the conventional medicine is they are pushing people, unfortunately, I must say this, towards death. Especially in type 2 diabetes, when they put on insulin, person is getting worse. His situation goes from bad to worse. Luckily, somebody must have. Who has referred us, Hasib bhai, to us? Who has referred us to you?
Aisha Yaqoob.
Okay, yes. She's one of the clients who came to us. She went to 3 gastroenterologists. Her video is already there for you to watch there. She been to 3 gastroenterologists before. And what happened? She was put on PPIs and too much of antacids. And she came to a platform with so much of struggling she was. And we could help her reverse her situation. And today she's medicine free. Like Mr. Yaqoob, we have been trying to make him medicine free. And he's completely medicine free in terms of diabetes. He's not taking no medication for diabetes, because we brought him off insulins, because insulin is such a dangerous thing to give on type 2 diabetes. Never give type 2 diabetes insulin in type 2 diabetes. I understand insulin is life-saving in type 1 diabetes, not type 2 diabetes. Type 2 diabetes, the patient will condition go worse because already too much of insulin got released, and because of that they develop insulin resistance. So this is what we are trying to bring to your knowledge, that please don't get stuck with medication, and don't be like a sheep. Just go, when you go to a doctor, don't be sheep, please. Just ask the doctor, why having this issue, why this hypertension, why this cholesterol, why this, that all our reason is one only, that is hyperinsulinemia. Too much insulin got released. So now he developed all these issues because once he put on insulin, suddenly his condition deteriorated. He got heart attack, his kidney got worsened, his kidney issues worsened. So this is what insulin is doing, and his hypertension was fluctuating. His blood pressure was fluctuating, and he developed hypertension events when he was put on insulin, because insulin is what such a dangerous thing. It normal level, it is life-saving, but once too much insulin goes in our body, it creates hypertension. All these symptoms are because of insulin. Type 2 diabetes, cholesterol, fatty livers, PCOS, like few cancers, fatty liver, all these things fall under one issue, that is metabolic syndrome, and that is because of hyperinsulinemia. Too much insulin got released. Never give insulin or never take insulin in type 2 diabetes. If you are stuck with that thing, we are there to help you, guide you, and bring you off medications. You have a great example here. At any age we can do that. He's plus 60. He's bedridden. God bless him. We're trying to encourage him we're putting him in physiotherapy regularly. He's doing physiotherapy. We are giving him best of foods. When he came to a platform, he's completely not at all verbal at all. He was not at all verbal. He was in a trials tube when he came to a problem, and slowly we changed his food and diet. And today he's off medications. He doesn't require anything. Only his current issue, what he's saying is having some issues with his leg pains and lower backache because he's bedridden. And with circulation issue is there, slowly he will develop. If he continues doing that, that's what we're encouraging him, doing physiotherapy, a little bit of exercises, and with the food as a medicine. Hopefully he'll improve that's condition as well very soon. Before we go, I want Brother Hasib, the son of Mr. Syed Yaqoob, to give a small message to the people who are stuck in this kind of medications, because he has seen very closely his father. His father has gone through that this whole issues, and he has seen it very closely, and has seen the reversal journey of the father after joining our platform. So Brother Hasib, can you just a little bit tell what should be the message which you want to give to the people who are watching this show and are stuck in, especially with diabetes medication, and people are taking insulin? Please tell something for them.
So we have seen very good result after joining your company, your course. Before joining, he was on insulin for a year. Later on, before that, he doesn't have any medical history. He was completely fine. After starting the insulin, he got multiple things. But now, after joining you guys, we have seen much more improvement from him. He has started speaking. He has started moving by himself. And currently, only one medicine was he was taking. Later on, he was taking almost 10 to 12 medicines on daily basis. He was on IV. But now, Alhamdulillah, after taking your diet and following it regularly, we have seen much more improvement. So after connecting you, we got to know what's the cons of insulin. Before that, we were not aware of that.
Correct. So what is the message you want to give to the people who are watching? Don't get stuck, isn't it, with medication? What is the message?
Yeah, just to go through a healthy diet.
Yes.
Don't just got stuck with medicines.
Yeah, right.
We have seen a father, he has completely skipped all his medicines just because of a good diet.
Correct. That's what. So this is what we give at our platform. What we give: remissions and reversals. People who are watching that,
yes,
please keep tuned with us for such great testimonials. We'll be keep posting that so that you get inspired and you shouldn't get fooled by the doctors, endocrinologists, and super specialists, unfortunately. Because especially when I see anybody, any person who coming to my platform with type 2 diabetes with insulin, I really feel my blood boils when I see the doctors putting people on insulin, because that's when the condition goes worse, from bad to worse. So kindly watch us and keep an eye on us, because we'll be sharing you with what valuable information and valuable testimonials so that you can change your life. And there's a help beyond hopes. So kindly keep following us, and share this video to your family, friends, and people who are put on insulin. Kindly share this video to people who are put on insulin. This is a great example of Mr. Yaqoob. Any age, what your age you might be, it is reversible, it is possible with the hukum of Allah subhanahu wa ta'ala. This is what we are giving our platform, Remissions Reversal. Thank you for watching us, and keep sharing this video and sharing these positive words of hope to people who are struggling because of the chronic management of the diseases through medications or insulin injections in type 2 diabetes. Thank you so much. Take care.
Thank you, Jazakallah.
So I'm ending the recording. Thank you.